You must consult the user manual for the full contraindication list before treatment. This video does not replace training led by an authorized specialist. Always read the user manual before using the Emsculpt device. Do not place the device in direct sunlight or near heat sources, as it may lead to an excessive temperature increase for the device. Also, do not cover the device or the applicators during the treatment. Position the device near the treatment area as demonstrated. Ask the patient to remove all jewelry and any metallic accessories, including piercing, before treatment. The patient should also avoid wearing any clothing with metallic parts, such as zippers, bra wires, etc. Do not place any metallic item, as well as any electronic devices, cell phones, data carriers, credit cards, etc., close to the applicator. Attach the belt to the applicator. The patient should remove clothing from the treatment area. For treating biceps, ask the patient to lay down flat on their abdomen. Put the applicators under the biceps. Secure the applicators with the help of the fixation belt. Make sure that the applicators are adequately secured to avoid any applicator movements during the treatment. This application can also be performed in a sitting position. For treating calves, ask the patient to lay down flat on their back. Put the applicators under the calves. Secure the applicators with the help of the fixation belt. Make sure that the applicators are adequately secured to avoid any applicator movements during the treatment. For treating triceps, ask the patient to lay down flat on their back. Put the applicators under the triceps. Secure the applicators with the help of the fixation belt. Make sure that the applicators are adequately secured to avoid any applicator movements during the treatment. This application can also be performed in a sitting position. Select desired protocol and applicator channel. Start the therapy. Increase the power intensity until reaching visible contractions. Correct the applicator's position to find the best muscle response. The patient should feel contractions homogeneously across the treated area. To ensure therapy efficacy, increase the intensity up to the patient's tolerance level. For an effective treatment, keep the treatment intensity at the level which causes the strongest possible muscle contractions. Emsculpt treatment may feel very intensive, but should never be painful. Adjust the position of the applicator so that the contractions are as strong as possible. You can adjust the position in multiple directions, elbow to arm distance. Rotating the patient's arm can also be helpful. Tilt of the applicator. It is important to maintain verbal contact with the patient during the treatment. Ask them how they feel, adjusting intensity and position accordingly. The patient should feel intense but tolerable contractions without any pain. Keep checking for comfort level and contraction intensity regularly. It is essential to make adjustments during the treatment if necessary to maximize the efficacy. Continue to increase the intensity during treatment if tolerated well by the patient. Lower the intensity temporarily if the patient reports discomfort. There should be no pain. Try to increase the power back to original levels if the patient can later tolerate a higher intensity. Remove the applicator when therapy is completed. The patient may feel mild muscle fatigue after the treatment. The applicator is not secured by the fixation belt. Cables are over the patient. Do not start the treatment when the applicators are still in the holders. If the pulse quality monitor interrupts your treatment, make sure the applicators are positioned properly.